to Yesterday, Today, Tomorrow. My name is Mariana Cordier, and I am your host. I'm coming to you via Zoom from my home. The United States is on its way to vaccinating the population. Many are uncertain what life will be like after receiving a vaccine. Joining me today to discuss our possible new normal are Dr. Stephen B. Thomas. He's a professor on the Health Policy and Management and director of the Maryland Center for Health with the University of Maryland. We have Mitch Markowitz. He's the vice president of business development for family and nursing care. And we have Martin Wollesen. He's the activator of unimaginable possibilities. It has to do with art. Gentlemen, welcome so much for being here with me. I am so excited to talk about what's going to be our new normal. Dr. Thomas, let's start with you. What is it going to look like for the population once we're vaccinated?
Well, let's start with where we are right now, because it's quite sobering that today we hit the unprecedented number of 500,000 deaths in the United States due to COVID. And who could have ever have imagined that? And
it's so such a devastating number. It's just heart-wrenching, especially when you hear those personal stories.
Well, I'm just so glad that the news media is putting a heartbeat on those numbers, because it is indeed staggering. And so I think we're a long way from that everyone vaccinated. And so this is the time to think about what the tomorrow might be. And I just hope that tomorrow is not what yesterday was for people who look like me, because going back to normal means Black people live sicker and die younger. And so I'm hoping that there are true lessons of this pandemic, that we move forward. And that's why I use the window you see behind me, because the AIDS epidemic also gave us an opportunity to demonstrate how we deal with conspiracy theories, how we deal with stigma, how we deal with marginalized populations. And I just love the art that came out of that period. And for me to have this stained glass window with the AIDS ribbon in it is a recognition of we do know how to be creative, how to create new iconography that bring people to a better place. So I hope that we work together today. We minimize competition, we maximize cooperation, and work together today for a better tomorrow.
And that probably means that since things are not going to improve overnight, that we'll have to continue with the CDC recommendations. Is that your understanding?
We will be wearing masks. We probably should have started the show in masks so we can role model. We will be doing social distancing even after the vaccination. And but there is something that I hope we're all learning now, and that the social distancing, the isolation that we've all experienced may help us have a greater appreciation for the human connection that we're missing, that we take the time off the hamster wheel that we were on before the pandemic. I found myself looking out the window and calling my wife because I see a red-headed woodpecker on the bird feeder. Like, I'm really excited. When's the last time I took time to look at the birds? Okay, to look at the snow. And so we've gained some reflective time. I hope we don't lose it.
Well, that's interesting that you say that. And it's a perfect segue to Martin, who, I think the arts is one of the areas that I think felt the impact of this pandemic. But I think it's opened some opportunities, has it not?
Yeah, it has. I mean, I was reflecting on this question about how will life change when we get back to the new normal. And I think in a lot of ways, to be honest with you, life had already changed. The pandemic just sort of kicked us into an awareness that we probably could have and should have had earlier than this. And I think one of the, there's a number of issues, but I think one of the key takeaways, I suppose, is that the arts, particularly the live performing arts, and as well as museums, are really coming forward with a reckoning around technology within their environments and how they deliver arts to audiences. And that has been a very resistive idea for so long. But I think, one of the things that we sort of forget about is that we are actually living in the most artistic and creative time in the history of humankind. And that is partly brought about because technology has given us access and the tools and resources to be artistic and creative, right? In fact, it's giving us the ability to be what humans have always wanted to be and always have been, which is creative, artistic, participatory, curious, and social. And I think art organizations haven't fully grappled with that idea. There's a lot of talk about dwindling audiences or dwindling interest in the arts, but in fact, it's just the opposite. More and more people than ever before are participating, creating, and developing and sharing the arts. But I don't think we've really captured that idea yet because the models we've built to deliver the arts are a little bit old-fashioned and haven't been built to be nimble as that sort of complexity of participation that technology allows us to do become more flourishing in our arts environment, if that makes sense.
It does. It totally makes sense, and exploring new ways of doing things. But I wanted to ask Mitch, one of the things we're talking about is what our new normal is going to be, but, for the work that you guys do, providing nursing assistance, in private homes and facilities and such, when the pandemic hit, you guys weren't really ready for something like this, were you?
It's funny. We like to joke, I guess is the best word around the office, that we did our SWOT analysis to do our business plan for this year. And what are the things that we think are going to show up as threats to our business, to our industry? And nobody put global pandemic on their bingo card. So we were not prepared. Nobody was. You look at the hospitals, you look at the nursing homes, and it's very much a similar feeling of running as fast as you can to just try and protect everybody to be as safe as you possibly can. So a year ago, it's almost a year ago to the day when we said we need to go virtual. Our whole business is going to go virtual. We've got 1,300 certified nursing assistants helping almost 700 frail older adults on any given day, supported by an office staff of 60-some people in Montgomery County. And poof, that office is no longer. We're going to all work from home and figure out how we can give all of our clients and our caregivers the support they need. And the first step in the process is, okay, how do we get all the PPE that we need, all the masks, as Dr. Thomas, the gowns, the everything that we possibly need, the gloves, to make sure that our caregivers have what they need to keep those clients protected and safe.
I imagine that your budget for the new year was preparation a little bit different.
You know what? It's a work in progress. There's no question we didn't budget for any of that last year. And then it came, the next big hit was testing, because it was not something that was provided to us the same way it was hospitals and nursing facilities. So we created a testing program where now we have 5 days a week. We have our open office hours for our caregivers to be tested to make sure that when they go into our clients' homes, that they are not carrying the coronavirus. And now the third phase, you nailed it again, Dr. Thomas, it's the vaccinations. How can we as quickly as possible protect all of those caregivers? We're into the hundreds now of caregivers that we've gotten vaccinated, which is fantastic, but it's a challenge as everybody's experiencing trying to get their own appointments. We're trying to get all of our caregivers and all of our clients through the doors to make sure that they're protected as well. So it's been quite a journey this past year.
I'm sorry, are you finding it challenging to get everyone vaccinated because they don't want the vaccine?
So no, so to be completely honest with you, we haven't gotten to that point yet. I'm sure there will be some folks that are not as comfortable with vaccinations. We're still kind of in the throes of lots and lots of folks know that for their livelihood, on the caregiver side, they do need to be protected, and they're very willing to do it. The challenge has, quite frankly, been getting the appointments through the county and through the other resources. So once we get through those folks that are really excited and willing to do it, we also have at the same time, it's kind of a parallel track, an education program going about the vaccine and some of the myths that are out there, trying to put out some of those myths. But yes, we're going to continue to educate, and our goal is to get as many of our folks vaccinated as possible.
Dr. Thomas, what could you comment about the issue about the confidence that some communities have and don't have with regard to the vaccinations?
Absolutely. And I'd like to comment on Mitch's work. I want to salute you, my friend. I really want to salute you and those of you working in the industry, because so many of your workers around the country who serve the elderly may not have seen themselves as essential workers. And so now, guess what? They're essential workers. And I think that's been an eye-opener. When remember the airport flyovers and people were out and clapping, it wasn't for everybody. And everybody's not a surgeon. Everybody's not going to be in the ICU. Hey, how about the person who comes in to clean that room afterwards, that janitor? How about the cafeteria people? How about those working in low-wage jobs in nursing homes? So I think that we've also exposed the rankism that exists out here. And so we have seen our system break. And my hope and goal is that we fix the broken parts. And in doing so, we can become stronger. The issue around hesitancy, I think that we need to acknowledge that there are reasons that people are hesitant. And they may find themselves in the same situation, but come at it from different points. There are people out there before COVID who were true anti-vaxxers. They didn't want to vaccinate their children for school. They didn't want to get measles shots or mumps or rubella. The anti-vaxxers who are hesitant or resist the COVID vaccine for those reasons are quite different than African Americans who are hesitant because of a history of research abuse, because of the lingering memory of the Tuskegee syphilis study. And how did they take those cells from Henrietta Lacks and create this multi-billion-dollar business? And now they want to take my blood, they want to take my antibodies. So all of these things have to be part of a conversation. And I think that's what's been missing. There's been a lot of talk about messaging. How do we message? That means I want to message to you to get you to do what I want you to do. That's a lot different than a conversation. And our whole approach is to open up a conversation and to address not only COVID, but the underlying institutional barriers that the pandemic has exposed.
So for opening up these conversations, how would you recommend different jurisdictions to do this? What would be a good way to engage the community?
Well, interesting enough, the pandemic has forced town halls to be on Zoom. And all of a sudden you have members of the community tuning in as long as you have the internet. And so now we're seeing that if you're going to make the internet a pathway to life-saving information, a pathway to life-saving registration for my vaccine, then you better make sure that the internet is as available as clean, fresh water, a utility, not a privilege. And my concern is that, well, I think that we have to fight to make sure that we don't forget, that we build out our internet to those communities that have been left out, and that we make sure our seniors, we've been working with our neighbor across the street who's 85. She would have been in the first group, but guess what? She's not in a nursing home. Haven't we been encouraging people to age in place? And by her aging in place in her own home, now she has a barrier to overcome to get access to the vaccine. She has an iPad. She can't sit around refreshing. And when my wife was working with her, my neighbor said, "I feel so stupid." And that's when my heart broke, because she's not stupid, far from it. These systems are making people afraid. And
I agree with you. I had a neighbor of mine who's 83 and a retired medical doctor who couldn't get his own appointment, and we helped him out, and because he just wasn't as tech savvy and didn't have the support staff because he was retired as he may have had when he was practicing. And so it was an eye-opening experience for me, because I thought, being a medical doctor and training and knowledge or whatever, that it would have been easy peasy, but not so much. And so getting those appointments has been a struggle. And Mitch, do you guys do anything for your clients to help them with the appointments and such?
We've been trying to work with the family members as best we can. The best way that we can help them is by providing the transportation, because to your point from earlier, these folks are isolated. It's very difficult to get those vaccinations brought out to individual homes. We're just not there yet. So we've had our caregivers that have been able to help provide the transportation to the vaccination centers. And we're relying, quite frankly, on family members to help them get the appointment scheduled. It's just a resource issue. It's really a shame that there are so many folks that need the support, that need to be put through the process as quickly as possible. And it's just not set up yet. It's going to be a little bit of time before we have those vaccinations that are able to go door to door, like we're hoping.
And Martin, I don't want to leave you out of the conversation, but the artists that are, living this as well with everybody else, aren't they struggling right now?
Yeah, artists are struggling deeply. A year ago, in 1 week, for many, many, many artists, their entire livelihood stopped because they rely on live performance and sharing and touring. And so, again, they are also learning how to adapt. And I think this question that Stephen brought up earlier about technology is becoming more fundamentally important to how we connect with each other, from a medical point of view, from a human point of view, certainly from an artistic point of view. And I think we do have to begin to think of that, as he said, is thinking of it as important as a resource, as water, because this is becoming a vital way for people to connect when other traditional avenues or well-used avenues are no longer available to us. And it's also true in terms of there's lots of work being done, as you would imagine, in performing arts organizations and arts institutions on planning for bringing folks back. But that's a very different question than whether folks are ready to come back when you are open up. And it's a very different question in community A versus community B, state A, state C, particularly for artists who tour. Their ability to adjust to these very different safety protocols is incredibly onerous. And so it's not just a matter of the vaccine being delivered in the case for people to get together. It's also creating a consistent way in which people can be together, which I think we're very far away from in the arts.
And the willingness to pay for a performance or to view something that's virtual as opposed to live, does that impact the process?
It's a huge, huge issue, and a lot of folks are struggling, and there's been some mixed sort of success across the board. But one of the things I think we are starting to see, just like with Zoom meetings, where we resisted it early on, it is now something that we are used to doing, that we're accomplished at doing, and the technology will get better and make that more easier for us. But arts organizations and audience members are still struggling with trying to figure out how to come together again. And part of the problem is that there's just not consistency from community to community about how to do that.
And Dr. Thomas, you wanted to comment on that?
Well, I just wanted to tell Marty, here's my salute to you, my friend, my brother, because when we were working together at the University of Maryland, one of the things that we did was to create an art installation based on the Black Barber shop.
Yeah.
And for a whole semester, we had students, dramatists, script writers, set designers, all the different parts of the theater industry, spend an entire semester in a Black Barber shop listening. And they came back and they created something that was so amazing. An art installation. And Marty comes into the Clarice Smith Theater, and there's a cube that is literally a barbershop in a box. And he comes in and he sits down in a chair, and a computer generates the Barber behind him, and they start talking and telling stories to one another. And I thought that was just such a creative way of taking a cultural experience. And then we could take that and put it in a bank lobby. We could take that and put it in a mall. Different ways in which we bring our community back together. I think the arts are so important. I think this pandemic is happening so fast, Marty. We don't have the iconography. We don't have what color is the COVID ribbon. Right. People think it's just going to go away.
Yeah.
And it's not.
But you're at a point where, in a lot of ways, we've done this work before. So we're not always starting new. And so that example is a great example, because in a lot of ways, what that says is, at a most fundamental level, what we know is that artists will always create, and people will always be creative and find ways to share those creative experiences. I think the other thing that tells us is that art exists and can and should exist in every place, and that we need to sort of separate from the pandemic sort of set of questions, is that the arts need to be less temples where we come to revere and genuflect and immerse ourselves in a certain set of rituals, is to really create community spaces where art happens and art thrives. And that's a different way of thinking about how to connect with the arts. And Stephen, you were right ahead of the curve and thinking about how that's possible.
And Mitch, what do you think about that?
Oh, I mean, I applaud your efforts. I think that this is not just from the perspective of the artists, but from the audience, for lack of a better term. We need this, right? We're seeing higher levels of depression and social isolation than we have ever before, because we're going on a year now without being able to hug our loved ones. I mean, I'm thinking of my own parents. We have a nice day coming up this week, and I'm going to try and squeeze in a patio lunch with my parents because we're still not doing indoor visits with them, right? So you think of all these folks who are socially isolated, who don't have the ability to hug their family members or grandkids like my parents would love to. And we've got to figure out how to bring that connection to them. And I think I've seen so many neat things that professional musicians have done. They're doing private concerts for folks. And they're personalized greetings for a holiday gift or for a birthday present. I mean, God bless them. They've got to find whatever way they can to stay alive, to get, to keep the revenue coming in. But it's so powerful and meaningful as well. On the other side as well, we really have to be able to reach out to connect with those folks who need it the most.
And Mitch, just like in the AIDS epidemic, I remember going to plays in the theater where it was at the bedside of a dying AIDS patient. Very, very creative. And moving forward, while the topic has changed, I think there needs to be a play that takes place in a nursing home and actually do the play in the nursing home. But definitely those scripts should be being written now. And Martin, I don't know if it's too soon for that kind of artistic expression, or are there grants out there that need to be made awarded? We need some artists right now to work with us on a graphic novel, taking the COVID-19 information and translating it into forms that we can disseminate in the barbershop.
It's not too late. And again, as I said earlier, the great thing about artists is they always create. And the other thing I think I want to say is that creativity, which obviously includes the arts, but as well as many, many other fields of endeavor, actually thrives in that uncomfortable space of uncertainty, right? And we are certainly in that place right now where we are. It just sort of reinforces that there's just a huge value of putting imagination and curiosity at the forefront of our conversations and our problem solving. And I'll also say there's this quote that I just love from James Baldwin. And he says that the purpose of art is to lay bare the questions that have been hidden by the answers. And I just love that as we try to grapple with, and in many ways discard, the answers that we have lived with for a while that have not been useful in helping us move forward, right? There's a lot more questions we really need to dig into. And the arts is particularly good at helping us sift through that complexity in these difficult moments.
That's very well said, because I think the arts is also how we hear, what we have to accept as our reality and what we need to do to make it better or to address a particular social issue or concern. And it's the delivery of that art that it seems is more palatable to the public and or accepting, rather than hearing, experts talk about what they think it is or isn't, or what needs to be done or not. And so I definitely agree with that. So Dr. Thomas, a year from now, when things have not really probably progressed a whole lot, what are some recommendations for the public to keep the hope? Would you share with them or encourage?
Well, there's something very interesting about being naive. If we had known at the beginning of this pandemic that we would be doing this for a year, I think we would have all freaked out. And so now it's been gradual. So if I say to you, a year from now, we'll still be doing this, we might all freak out. I think that right now we need a pandemic of kindness. We need to start a campaign where we make a commitment to every day do something kind. It can be small. Your neighbor's paper, your elderly neighbor's paper is out there in the snow. Put it up on her porch. You're finally in the grocery store. There's an elderly person or someone that could really benefit from your help. Pay for their groceries. Don't have to make a big deal out of it. It's not a big TV thing. But if we don't get back to that, we're going to be dividing ourselves by, Mitch, do you have your vaccine? I can hang out with you. But Martin doesn't. He can't come over. And all of a sudden, we're going to be segregating ourselves by who's vaccinated and who's not. I think it's a terrible situation that we're witnessing, and largely because of lack of national leadership. You can't erase 4 years in 4 weeks, but the hope that we currently might see is very fragile. Because if we mess around here and let this virus continue to evolve, it will change.
Well, you have got the last word because we are running out of time. I'm sorry to stop you there, but these shows are always so short, but I got to say goodbye. So thank you. Thank the audience. Remember to watch Yesterday, Today, Tomorrow, and we're on YouTube. Good night.